Hello, everyone. My name is Mitisha Gupta, and I am your host for today's podcast, Win Over Hypertension. Where you can learn how to take care of your blood pressure through exclusive insights and practical advice. Today, we're talking all things about hypertension. Why is it caused, how it matters, and most importantly, how to take care of it effectively. Hello, doctor. It's my honor to have you on this podcast today.
I'm Dr. Souvik, consultant physician from Howrah. Today's topic of discussion is awareness about hypertension. And that's a question regarding the hypertension, very common disease around the patient population.
So, doctor, by now we all know what hypertension is. But can you please elaborate on it? I mean, why is it so important for us to take care of ourselves even when we feel fine?
Now, we know that hypertension is very common in our population. Often, it is not diagnosed. In fact, the patient is hypertensive, but it's not diagnosed. But if the patient is hypertensive, there will be significant damage to his brain, kidney, lung, heart, all organs will be damaged. So, it's very important to know that the patient is hypertensive. They should make regular checkup from the doctors, and even if not doctors, but there may be a home BP monitoring also is important. So, even if the patient is feeling fine, but he is hypertensive, it's important to diagnose him or her with that he is hypertensive and go for the medication or go visit to the doctor.
Okay, but why is it so often called the silent killer? What makes it so dangerous over time?
It is called silent killer because people can live with hypertension and there is a severe hypertension, but they even without knowing that they are hypertensive because there may not be any symptom. So don't look for any symptom. Just do regular checkups, either home BP monitoring or go to the physicians and diagnose whether you are hypertensive or not. So a symptom of hypertension is also important because if you are not having symptoms but you are having hypertension, there may be increased risk of damage to the organs like cerebrovascular accidents, like there may be retinal hemorrhage, there may be heart attacks, nephropathy, several things may. So it's very important to diagnose, otherwise there is silent killer and it is responsible for around take more than 10 million deaths or in death in all over the world. He is responsible for 57% of the stroke and 25% of the coronary artery disease.
So, doctor, I would like to know what are the most common reasons people develop high blood pressure? Is it genetics, lifestyle, or something else?
The reasons are there. There is a primary hypertension cause, there is secondary hypertension. Maximum people develop primary hypertension, more than 90% of the population.
How is blood pressure exactly diagnosed? When looking at the blood pressure readings, can you elaborate on the exact numbers people should be looking at?
Reasons are there. There is a primary hypertension cause, there is secondary hypertension. Maximum people develop primary hypertension, more than 90% of the population. What is primary hypertension? People develop hypertension, due to lack of exercise, due to stress, due to poor dietary habits, and some genetic factors are there. Like if the parents are hypertensive, you have 2 times more tendency to develop hypertension in future. And some secondary causes of hypertension, there is renal cause, like some hormonal disease like Cushing syndrome. These are the secondary causes of hypertension, which is around 5 to 10% of the population. This is diagnosed in the clinic or in the home BP monitoring if it is more than 130 as a current recommendation. Previously it was 140, but if it is 130 now, it is hypertensive, and you have to be very cautious about the hypertension.
So, I would also like to know if someone has just been diagnosed with high blood pressure, what are the changes you would want them to make in their daily routine?
Before starting medication is the lifestyle changes. Reduce the salt intake to less than 2 grams per day. If possible, less than 1.5 grams per day. Exercise at least 30 minutes a day or 5 times a week. lose weight as much as possible, and this 5 to 10% of the baseline weight lose. Stop smoking, stop taking alcohol or limit the alcohol intake, and focus on the DASH diet, that is the hypertension associated diet. This will reduce the hypertension by at least 5 to 15 millimeter of mercury, reduce the blood.
Can we say that hypertension can be treated without medication?
There is the lifestyle changes as discussed previously. Around 60% of patients may require the lifestyle changes, but if it is not controlled with lifestyle changes, you should start medication, you should not wait long.
Okay, doctor, you just talked about medication right now. So, I would like to know what are the most common side effects that people should look out for while taking medications for hypertension.
So, it depends on which medications you are taking. If you are taking diuretics, then you have to increase the fluid intake, or there will be some low potassium problem. If you are taking beta blocker, then there will be easy fatigability, cold extremities, or some other problems may occur. If you are taking AC inhibitors, there will be persistent dry cough or hyperkalemia may develop. So it depends on which medications you are taking. But side effects are very much tolerable, and they may be managed with dose adjustment.
Okay, I have a question related to that only. Let's assume that somebody's blood pressure is coming under control. Can they come off medication, or is it a lifetime commitment?
For some patients, yes. If the blood pressure is within normal limit, you can try to off the medication, but the patient should be stringent to the lifestyle. There may be heavy dietary modification, and the patient should be very much come to the clinics regularly for checkup of it. If it is possible, then the medications may be cut off, but it is very rare that population. Normally, the maximum population needs lifelong medication.
Okay, when you say reassess regularly, how often people should check their blood pressure, and what's the best way to do it right?
Blood pressure should be checked initially daily, and after control of blood pressure 1 or 2 times per week, and it may be in home blood pressure monitoring, it may be ambulatory blood pressure monitoring, it may be at physician's report.
I would also like to know what would happen if high blood pressure gets untreated for years, especially the body parts which gets affected the most.
This is a very important question. Blood pressure, if it goes untreated for years, increase the risk of CVA or stroke, increase the risk of heart attack, heart failure, chronic kidney disease, increase the risk of vision problem like the retinal hemorrhage, increase the risk of aneurysm. So the organ damage will be more.
So this marks the end of our podcast, Win Over Hypertension. I would like to say a huge thank you to the doctor for sharing such valuable insights to us. Remember, hypertension isn't just a number, it's a signal. And with right knowledge and action, it's absolutely preventable. If you found this episode helpful, do not forget to like, share and subscribe, and share your valuable insights with us. Always remember, stay informed, stay proactive, and most importantly, stay healthy. This is Mitisha Gupta signing off from this podcast, Win Over Hypertension.